My name is Justin Sinnott. I work with UCD Research and Innovation. I'm a research partner in that unit. And you're very welcome to the fifth in a series of seminars hosted by UCD Research Partners team. The purpose of the seminar series is to showcase ongoing COVID-19 related research at UCD across all disciplines. And the purpose is also to help facilitate greater interdisciplinary discussion and awareness of UCD's response to the COVID-19 crisis. So this seminar takes place via Zoom every Wednesday at 2 p.m. and it'll last for 30 minutes. And today's guest speakers are Dr. Carla Kayanan and Dr. Alma Clavin from the UCD School of Geography. So Dr. Kayanan is a political economic geographer with strong interests in the spatial organization of work in the tech economy and the resultant landscapes of urban inequality. In her capacity as a postdoc research fellow in the School of Geography, working with Dr. Niamh, she brings her planning background to applied reality of Ireland's new national planning framework process. This IRC-funded project situates and deepens our understanding of metropolitanization processes in Ireland and their role in achieving national strategic goals. Our other speaker today is Dr. Alma Clavin, and she's an urban geographer and lecturer in the UCD School of Geography also. And she has a focus on urban greening, green-blue prescriptions, repair and restoration. So today's session will take the form of a presentation and a discussion before taking questions from the audience towards the end. So please do submit any questions or observations or comments that occur to you during the courses of the presentation and the discussion that follows, and we'll try to leave some time towards the end to get to those questions. So you're all very welcome to today's seminar, and without further introduction, I'll hand over to Dr. Carla Kayanan.
All right. Thank you all for joining today. Really appreciate it. And thank you, Justin, for hosting our research through the UCD COVID-19 seminar series. So I'm here and really excited to talk about our chapter, Cities Under Lockdown, Public Health, Urban Vulnerabilities, and Neighborhood Planning in Dublin. Okay, so this is a chapter that we submitted for an edited volume called Global Reflections on COVID-19 and Cities, Urban Inequalities, and the Pandemic. And the call was for a series of short, reflective, engaged pieces that discuss the challenges and the opportunities to urban planning in relation to COVID, to the pandemic and its aftermath. It will be published by Policy Press and available at the start of 2021. And myself and my co-authors, Niamh and Alma Clavin, all at the School of Geography, contributed to the work. What we decided to do was to focus on Dublin 8 and inner city neighborhood to really try to understand. This is an area that has a large population of vulnerable groups that live in social housing complexes. So we really wanted to think through how stay-at-home orders presupposed a safe and adequate home environment for all. Why Dublin 8? So each of us, we were already working within that space. I'm currently there through a new foundations grant, looking at the rise of the tech sector in that neighborhood and the challenges it poses for issues of housing and homelessness. And Niamh and Alma were already in this space through an EPA research grant called Mapping Green Dublin to develop a greening strategy for the neighborhood. So we were already attentive and sensitive to the planning pressures in this neighborhood and the existence of these vulnerable communities. In the past 3 decades, Dublin 8 has seen repeated interventions by a range of government, construction, and real estate growth interests. And this has triggered concerns for a type of Docklands-style makeover. That's a reference to the Docklands development on the east side of the city that has, become one of the most unaffordable and somewhat inward-looking style neighborhoods. So the budding startups and the hotels and the student accommodations and the rising rents in Dublin 8 do point to a type of, positive development, but at the same time, by and large, longstanding marginal communities feel that they are underserved by green space, by public amenity, and high-end quality residential infrastructure. So I think that I have two quotes that demonstrate kind of these sentiments. All the bloody student accommodation in Dublin 8. I don't think they have one park, you know, they haven't given back. They've put up all these buildings, but they haven't given back to the community in terms of space. As well as more land disappears that could have been greened, I guess, or that could have been made available for social housing. So a real deep understanding of these development and planning pressures. And these quotes I'll talk about in a little bit, but they come from the research that we did in that space. Because we were already in that space, we were drawing from a wide range of literatures, critical urban theory, health geography, environmental justice, planning and design, and arts. And there's a lot on this page, I recognize that. But by and large, the idea is that the overarching pillar of the work is related to spatial and environmental justice. Building on that work, then, we wanted to really understand how the lockdown impacted these different vulnerable communities. So we conducted semi-structured interviews with the social service providers for these housing complexes, as well as the youth workers who service these communities. And then, particularly through Mapping Green Dublin, you know, this has come front and center, that it's the importance of the space closest in our microgeographies, the space that is closest to our bodies, that has the most impact on mental health and well-being. So with that in mind, here is the map of the project area. What you see here is a 400-meter buffer around the social housing complexes. Now, for an able-bodied average individual, a 400-meter buffer is about a 5-minute walk. And you can see here that, you know, around each of the estates, there is a lot of construction and very little green space. Here on the west side is St. Michael's, and yes, there is quite a bit of, you know, open space there for development, which is unfortunately, or well, it's under consideration now for development, and hopefully it will have a solid development that does include a lot of green space. So you say, you know, hey, wait, but there's Phoenix Park, this gigantic park on the upper screen. And yes, that is true. But again, I just want to highlight that it is the space closest in, the space that we experience on a daily basis, that we can access every day, that is most impactful to our mental and our mental health. And so that's why we are focusing on that space closest to each of the housing complexes. And then for those of you who might be familiar with the area, though it's kind of evident here as well, there are infrastructural barriers and natural barriers that make ease of access to the park somewhat prohibitive. Okay, so living with lockdown, what was it like? As one social service provider said, most of the community at Dolphin House, they live in 1950s housing blocks without their own private external garden or balcony. It's really difficult for the children to access somewhere safe to play, and that had a real issue on families. So again, these stay-at-home orders demonstrate that the home is differentially experienced. When there is space available, green open access space available, it's not necessarily well maintained. So as one youth worker said, the community center has an astroturf pitch on the back of it. It's not maintained, it's not taken care of. For us, we would love a space like that for young people. It would be constantly used. As well as there are green spots at the back of the flats, but they're not in a state to be used properly. There's a balance between people not using and respecting it and not being good enough to be respected. And to me, this, you know, this really resonates. This really speaks to how these individuals feel that they are being perceived and how they are being neglected. When there is space available, you know, it witnesses large space, large concentration of people. So as one youth worker said, at one point we met 40 young people hanging out in a group. And so sure, these people were flagrantly disregarding stay-at-home orders or social distancing measures, but the point is not to criminalize that type of behavior, but to really highlight that the lack of space meant that the few spaces that were available were used constantly and by a lot of people. And, you know, furthermore, this then prohibited young children or families from also using that space because of, feelings of intimidation with a lot of other people there. So I'll wrap up the presentation portion in the same way that we did the chapter, which is kind of stepping back and thinking about contemporary planning practices and where to move forward. So planning has shifted its origins that were in public health and redistribution to a growth first material logic, one that maximizes profit, and now one that uses density and concentration as a way to continue maximizing that profit. And this is a type of growth first materialist logic. Residential overcrowding, being able to access adequate internal space, ability to self-isolate are prescient planning concerns, and they force us to really reconceptualize the idea of home. Outside of the home, community bonds are critical to resilience. So not all the commentary that we heard through our interviews was negative, similar to what we heard in global accounts of communities coming together. That also happened in Dublin 8. There are strong bonds in Dublin 8, and people organize volunteer drives to, to provide more food or to just create community and help each other out to see each other through this pandemic. And that was very positive, but these accounts are also tinged with this concern that as development continues, it becomes harder and harder to age in place, to grow within and maintain these community bonds. And the lack of affordable housing means that a lot of these communities are going to be pushed further, or the existing people in there are going to be pushed further out, breaking these community bonds. So planning practice needs to consider the sensitivity of these community bonds, to consider the right to public health, to consider the lived experiences of these people and their desire to age and remain in place in a healthy and safe way. So the attention to the environment within our microgeographies also urges a return to urban planning to its public health roots, to deliver more just and healthy cities with access to green and other forms of safe outdoor spaces. So I'll close the presentation portion here. I thank you for your time, and we would absolutely love to hear from you. These are the channels that you have available to you, so please contact us.
Carla, thanks so much.
I'm going to stop my screen share. Is that okay?
Sure, perfect. Yeah, that was great. And really striking images and maps there, which really kind of captured the area that you were working in and some of the challenges facing the people working there during lockdown. So perhaps I'll just open with a question to follow your presentation and bring Alma into the conversation. I was struck at the very beginning of the presentation by what seems like real agility in the project team to shift your focus from an area that perhaps you were familiar with, but under completely new circumstances and challenging circumstances. And I'd be interested in finding out more about how you and the project partners responded to the restrictions around COVID-19.
Thanks, Justin and Carla. I suppose this presentation demonstrates one of the ways in which we responded, actually. So Carla's project Tech City Home and Mapping Green Dublin are both come from UCD Geography, and our conversations really began in February, March this year, when we realised the pressures in Dublin 8. And we started to have conversations around the interface between housing and green space in what is a pressurised built environment. So just to maybe recap a little bit about Mapping Green Dublin, it's an EPA funded project. It's led by UCD Geography, and partners are Common Ground, who are based in Dublin 8, an arts organisation, the artist Shodine O'Sullivan, and the consultancy Connect the Dots. So it was a collective response from all project partners. This is an action research project, so in a way we felt we had a responsibility to respond. The first phase of Mapping Green Dublin was about mapping the trees across Dublin City, and that work was carried out by Professor Gerald Mills. So we had that data, and the community already had that data. And what happened during lockdown was that those green space deficits became magnified, and it became clear to residents in the area that there was a green space deficit, deficits not only in provision, but also in quality of green space. So in a way, we wanted to support people on the effective component of that deficit or loss. One of our responses was to develop a project called Plots, which was carried out by our socially engaged artist, Shodine O'Sullivan. And socially engaged practitioners, in a way, are very dynamic and used to responding to crises such as COVID-19. And the Plots project, and the final slide there that Carla showed, that nice map, I don't know if you can bring it up again, but this is one of our Plots maps, which is one person's route within their 2 kilometre radius. So we asked a number of people to map their walking or cycling routes within their 2 kilometre radius. And we have a series of these maps, and this is something that emerged from the COVID-19 crisis. The research was grounded and iterative, and that ensured that we could be dynamic, actually. So in addition to mapping this 2 kilometre radius, we also started to examine, as Carla said, that green space closest in. And that meant we actually started to focus on the most vulnerable within the area, and focus in on the housing complexes, of which there are 4 within the area.
Okay. And just perhaps more broadly, I mean, I'm thinking just in terms of very practical considerations. And I don't know, previously, you know, my thought would have been that much of this work would have been almost ethnographic, or at least interview-based, or understanding and experiencing the lived environment and kinds of planning concerns that you witnessed. But maybe more broadly, for social science research, what are some of the implications, do you think, of these restrictions for researchers and for the communities that you research, given the fact that we are, you know, bound within a certain range of our own homes or our own institutions? What kinds of things can be done to counteract those problems?
Well, I'm not living in Dublin, and I haven't lived in Dublin since the beginning of the crisis. Our project partner is based in Dublin, and this ensured that our project could continue. So we had an ear to the ground, and working with Common Ground, who are a place-based organisation, really helped us. Pre-February, I was working in Dublin 8, and I had an office, thankfully, at the Common Ground offices. And since then, of course, I couldn't be on the ground, but we do have a project partner that is based within Dublin 8. So Common Ground were very supportive.
Great.
Can I just add to that as well?
Yes.
So prior to conducting the interviews, Alma and I discussed, well, are we going to try to do these on site, or are we going to do these over Zoom? And neither of us had really had the previous opportunities or experience of conducting these interviews online. And I mean, I have remained surprised with the ease of conducting interviews online, but there's also something to be said about the importance of that face-to-face interaction when conducting interviews. And then I think there was, Alma, I don't know if you want to speak to this, but Alma did go in during the lockdown and, you know, walked around the community. And I remember talking to her afterwards, and she just, you know, discussed how tiring it was to be that, you know, conscious of the surroundings, what, you know, scholars are talking about, the social scarring that we're left with, and thinking about being in these spaces. So it certainly does challenge the ability to do grounded ethnographic research, as you're saying, Justin. But I think we have to be creative in figuring out ways to continue to be, you know, to be there for the communities and to continue our research as well.
Yeah. And so I was struck also by some of the positive aspects of this, and I've heard this before elsewhere, that the sense of a community response in a crisis, you know, well, the response wouldn't have been required in other times, but it actually showed the real fabric of some of these communities and how they rallied around to support each other.
Yeah, and we have a greening forum, which is a loose collective of individuals interested in greening in the area. And what we saw is March, April time, everybody was quiet. And then we saw a resurgence in interest in greening in the area in August, September time. Right. And that has continued.
Yeah, it's a very interesting question from one of the participants, and they ask, and I think it's interesting because of our traditional focus on green spaces as spaces for leisure and activity. And the question is, in the city centre where there are not enough green spaces to begin with, and this is something that you obviously focus on, how can streets or perhaps non-green spaces play a role in relation to leisure and activity and that very important aspect of getting out of the spaces that are so close to us?
Well, interestingly, we carried out a COVID impact community survey, and that was one of the points that has come up actually. People are looking for more focal points within their communities where they can actually meet in a socially distanced manner, which is something that we didn't really think about so much before. And that's not only streets and benches under street trees, and the whole idea about how we use benches has now changed. But also areas within parks where people can just gather together, and also in our grey spaces. And we see some of our grey spaces in Dublin 8 now becoming greened with pocket parks and parklets and pocket forests.
Great. It seems to me that a great benefit of your research is that it demonstrates planning problems in the context of a crisis, or it really compounds those problems and really shows in stark relief issues that perhaps we may have been aware of, but some of the problems that really arise acutely in a crisis. When we think about the future and hopefully moving beyond COVID-19 in the short to medium term, what's your hope for these lessons that you've learned and how they might be brought into future planning exercises for these kinds of environments and elsewhere?
Well, I would hope that communities feel more confident to now articulate their greening needs. And I think from what I can see in the research, people are becoming more aware of the health and well-being impacts of greening, particularly trees and tree canopies, not just today and this year, but in 30, 40 years' time. So what will our green canopy cover look like in 30 years' time?
Okay.
So hopefully we've given the community the tools and supported them in some way to do that.
Great. Okay. And there's a question here from a participant, and they ask, can you comment on any efforts set up by the HEC or the government to look at the link between community design and COVID to inform ongoing responses? So perhaps, I'm not sure if we've just covered that, but a similar kind of a question. Carla, did you want to contribute on that particular question about lessons learned and what the future might look like and how we might draw some positives out of the crisis that we're living through?
Sure. I mean, I think that we are already seeing a lot of discussion around this. And we are seeing local governments and governments at higher scales responding to how we can be more attuned to the needs of communities and the needs of these communities to have a safe environment. So these discussions are definitely happening. And I think that they have been accelerated because of the pandemic and because what it demonstrated. So my hope is that we don't lose sight of these, lessons that we've learned and return to business as usual, but that we really do consider how to change the planning practice and how to consider needs of communities in any type of development moving forward.
Yeah. I was struck also by the slide towards the end of the presentation, which was kind of an interdisciplinary view of things, or thinking about all of the various departure points that you've used to carry out the research. For example, working with Common Ground and working with the artists and things like that. Could you tell me a little bit about your view perhaps on the requirement for an interdisciplinary response to COVID-19? And really what I'm thinking is, what is it that the university can do? What is it that funding agencies can do nationally to support that interdisciplinary response?
Alma, you want to go ahead?
Just thinking about mapping Green Dublin and our research in UCD Geography, I know we've been making attempts to do more work on the links between, for example, green and blue spaces in mental health. So I can tell you that social prescribing is alive and well in the Dublin 8 area. And we're hoping in the future to do more work, for example, on green prescriptions, so that there's a very clear link there between urban geography, planning design, and health research. And I know in the area, for example, pre-COVID, that social isolation and anxiety were the two main mental health issues. And that can only be exacerbated by what has happened over the last 8 or 9 months. So I know there are a number of projects looming between geography and the health disciplines, and I suppose more support in space to figure out a way forward for concepts like green prescriptions would be beneficial.
Great. Okay.
And I'd also like to just add that, you know, creating spaces like this to promote social science research, to promote what geography can do, to help us understand the impacts of this pandemic and how we can inform policies and practice moving forward, and recognizing that, yes, the social sciences and the humanities have an important role to play as well, just as much as the physical sciences.
Yeah. And I think increasingly we're seeing or understanding that the mental health implications of the COVID-19 crisis, you know, will have a very long tail, unfortunately. And so the role of social scientists and that interlinkage between planning and geography and space and health is just really important. And I think both of you have really demonstrated so clearly and the important work that you're doing. So I really want to thank you both for the presentation and the discussion. It's just 1 minute to 2:30. So I'm going to just thank you again and just wrap up by saying that next week's presentation in this seminar series, we'll be speaking to Dr. Deirdre O'Donnell from the UCD School of Nursing, Midwifery and Health Systems. And in a related topic, she's going to be discussing about the emerging evidence and new ways of working among health and social care professionals, providing care to older people during the COVID-19 pandemic. So I think a very nice follow-on presentation and seminar next week. So I really do want to say thanks so much, Carla and Alma. It's been really, really nice to talk to you. And for those of you that have joined us today, thank you very much, and we'll see you soon. So thank you very much.
Thank you all.